Welcome. Good afternoon, and thank you for joining us today. Thank you for joining us to learn more about what women want in retirement. I'm here with Kristi Rodriguez, Senior Vice President at Nationwide Retirement Institute, to talk about the results of a survey we conducted together on this important topic. Thank you for your partnership and welcome, Kristi.
Thank you so much, Ramsey. So excited to be here. And what better opportunity than talk about ways that we can improve women's viability through retirement. And I'm just so thrilled and excited about our continued partnership with National Council on Aging. So thank you for having me.
Thanks so much. So NCOA and Nationwide surveyed 1,500 adults over 50, both men and women. Some were preparing for retirement and others were already retired. And we found some interesting insights as a result that we'll share with you today. So let's start with some key findings for women who were still preparing for retirement. Women preparing for retirement. Our key findings clearly demonstrate figuring out how to afford a healthy future is weighing heavily on the minds of women looking to prepare for retirement. The increased healthcare costs tops their list of concerns, and many recognize they will either need to or want to continue to work in those retirement years. Yet a third are concerned about finding a source of financial information, a trusted, trustworthy source that can help them plan and navigate accordingly. Kristi, why do you think this is a challenge for so many?
Yeah, when I look at these stats, I hate to say it, they're moving, but we're seeing these continuously year over year. And I think it boils down to the fact that, Ramsey, that health and wealth are so deeply personal. But if I could extract two things, I love these stats that we have on the slide to anchor on about women knowing that they need help, and then also where they're going to go to a trusted person to get that help. So I look at it in really two ways. Women, we're living longer. We know that without a doubt. Within the last 100 years, we've increased our lifespan by 25 years, which means we need to think about living in retirement longer. And to your point about finding that trusted source, there is no better way than finding that trusted financial professional that can help women understand how they can manage living through retirement and also thinking about really the breadth of it with their loved ones. And so when I think about it, and what we advise a lot of financial professionals, particularly when they're working with women, and for the women in the audience, is seek someone that you can build trust with. Remember, you're going to this financial advisor in very much the same way that I would position you going to see a doctor or another trusted individual to improve your health. So you want to be able to really get down and help this financial professional, and they should be asking you probing, comprehensive questions about your why. What's important to you? What do you want to leave as a legacy for your family? How do you want to live in retirement? Not just those short-spanned years, but again, thinking about women in longevity. And then the other important factors I always like to bring up is bring your family along. There may be loved ones, family members, parents, children that you want to have part of that dialogue with your financial professional as you build that trust. Because again, this is going to be something that you really are going to have to think about in a much more holistic manner than I think women had to think about in years past.
Absolutely agree, Kristi, and really appreciate your framing as a holistic planning opportunity. We have to think about the dollars and cents. We also have to think about our health and our ability to work. For so many, it's clear that preparing for retirement also means preparing to keep working longer and ensuring we're investing in ourselves, our skills, our networks. Over half of women surveyed said they want support maintaining their employment, which is not surprising since 82% also said they're concerned about outliving their assets, literally losing sleep over this issue. So it's really top of mind. And the pandemics demonstrated for us how important it is to invest in your skill building and your networks, especially for older adults that want to keep working. So now let's look at issues for individuals already in retirement. So women already in retirement, what is top of mind according to our survey results? Let's take a look together. So once again, top concern really is costs and expenses. Not a surprise, especially as we're looking at record-breaking inflation rates. This time and energy and concern in regard to costs is what's weighing heavily on women's minds, especially in regard to long-term care, those long-term care costs. So it's not surprising that nearly half of women said they want help planning for those long-term care needs. Kristi, what are your thoughts on that?
Yeah, I mean, again, this is just startling. And I think back to that last stat that's on this page is that, they don't know what to do about it. And you just hit on it so well, Ramsey. When we're talking about this holistic financial planning, we cannot have discussion as women without thinking about long-term care. And I often get asked, really, what is long-term care? And I'm going to share a slide in a moment, but I thought it was important just to level set that we all know long-term care can happen subtly and it can happen gradually. It's when you have the inability or you'll need additional support to care for yourself, both physically and mentally. What we're also finding is historically, individuals thought about long-term care in a facility. More often now, we're hearing women and really all aging Americans saying, I want to age in place or age in my home. And that's why this long-term care discussion is so important. And I know we're focused on women that are already in retirement, but I would encourage us to have that discussion actually when we're preparing for retirement as well. I wanted to bring up, I love the show Mythbusters when it used to be on television. So I wanted to bring up a couple of myths that we have as it relates to retirement around what is available for long-term care. The first is Medicare. There is a myth that Medicare will cover long-term care costs. It does not. And so unless you have a way to subsidize your long-term care expenses, please don't go into your retirement discussions thinking this is something that will be covered by Medicare. The second that I often hear is that, the long-term disability that I purchased through my employer is actually long-term care. It is not. That is looking at long-term disability in case there's a disability event that you may have, in your workspace. And so I really want people to understand the nuances and the differences of looking at long-term care. And again, going back to that option that I talked about, whether it's aging in place in your home or in a loved one's home or in a facility, you really want to understand, those costs. And then that actually gets to the third myth, that long-term care is about $50,000. Well, that might cover you now for maybe a year or a year and a half. Long-term care costs are rising and for a number of reasons. But I think I want to point it back to the data point that I made previously is that women are living longer. And so your ability to have long-term care over expanded period of time is going to be imperative. And if I could just quickly share just the story I often talk about, sometimes it's my own grandmother. My aunt actually moved in with my grandmother when she was in her 70s. She's actually 71. And she was thinking, okay, I'm going to be with mom and I'm going to care for her. And we're putting money aside. And, we may have a good 5 years. Well, my grandmother lived till a month shy of her 99th birthday. And so again, that goes to the importance of longevity with women, actually having a plan to talk about it with your loved ones and finding out where they want to have that care facilitated and really understanding what those costs may be.
Fabulous points. I mean, as women, we see it up close and personal with our mothers, with our aunts, with our sisters, and this pandemic in particular has really shown a light on our own considerations about aging and aging in place and aging in our home, and really being thoughtful about what's needed, the resources and the retrofitting. And it's so important to plan for those costs to the extent we can, because I love your Mythbusters. I mean, so many do think, I can't wait until Medicare eligibility. Lo and behold, it doesn't cover everything. So it's so important to have those conversations early, holistically, and with trusted advisors and family members. But let's turn to another striking fact from our survey findings. We discovered among this group that nearly half of the women surveyed said they're not sure they can cover the cost of an unexpected emergency expense that would require about $2,000. and a quarter said they would like help learning about benefits programs that could help them with daily expenses for themselves or for loved ones. And we know from our work at the National Council on Aging that far too many older women struggle to make ends meet every month and or provide help to their loved ones that struggle to make ends meet. And there are programs out there that can help close the gap. We'll talk a bit about some free resources later in our conversation that might be able to help individuals with those very issues. But now let's look at some of the gender differences we found when it comes to caregiving issues. Caregiving and the gender gap. Quite an opportunity for discussion. So Kristi, your thoughts on these data?
Oh, wow. Yeah. First of all, I just want to piggyback on something that you said, Ramsey, before I get into my thoughts around this. Caregiving in women is such, it's a profound conversation. It is one when we look at both ends of the spectrum women deal with. We deal with it when we are caring for our young children when they come into the world, and we're often the caregivers for our aging parents or loved ones. And we take it with such pride. Like, this is what, we feel we are meant to do. But it does have a significant impact, as you see on these statistics on this page. Really, when I look at the one of saying caregiving is a strain on their finances by 70%, that is just startling to me, because we know that impact will have a long-term impact on women as they live longer as well. But really, when they're in this bit of a panini situation, and we often call it in Nationwide the double-edged sword, caring for your young adults in your life, caring for your older aging parents, and then planning for yourself. And that strain is real. And I don't care really what industry or sector you're in, that can have a profound impact on your finances. The other one that really shocks me, and I've heard this firsthand from talking to various women, talking to financial professionals and advisors, around women saying, can I even retire? So that postponement of not having that holistic plan, is also critically important as we're thinking about these gender gaps, and really making sure that we're thinking about ways that we can address and combat this issue. And to your point, I know we're going to get into that a little bit later in this conversation, where we want to, one, equip you, and then also think about ways that you can empower organizations such as NCOA and Nationwide to help support that effort. But Ramsey, I would also want to ask you, what changes do you see in a way that we can improve these statistics?
Well, I think there's a world of opportunity here, no doubt. We can only go up. We'll just say that, in terms of improving the experience for caregivers and honoring the experience and the contributions of caregivers. I 100% agree with you. We bear a badge of caregiver in chief as women, sometimes identifying, sometimes not self-identifying, just doing what needs to be done in regard to caregiving, because that's what family does. And count me among the panini sandwich generation. I've got young children in elementary school. My mother lives with us, and here we are. And it's just what family does. And it's such a gift. It's so wonderful. Yet there are financial consequences to those caregiving obligations, as women know too well. Too many women bear those financial consequences in the short term and the long term. Out-of-pocket expenses in terms of providing the care for the loved ones, and then hits to wages over the long haul that can really be quite detrimental and add up considerably later in life. But there are policy solutions. I'm ever the optimistic one, and I know that we can change. We can better honor those contributions. For instance, a caregiver credit for Social Security would shore up at least a part of retirement income by honoring those years and those contributions, raising the next generation, taking care of older, frailer family members. And there are proposals that have been put forward that would provide that type of caregiver credit for Social Security. We also can do better financing home and community-based services to alleviate some of the caregiving burden on families. We saw in the pandemic so many women leaving the workforce to shore up caregiving on the home front. But really, with the proper investments in home and community-based care, like those we're pushing at NCOA to maintain $150 billion in Medicaid funding under conversations related to the Build Back Better Act, would really ensure we could better meet the need and provide more wages and benefits for the workforce that's so very critical to providing that direct care. And if the pandemic demonstrated anything, we saw no work is possible without care work. Those kids need to be taken care of. Those older, frailer loved ones need to be taken care of so that those of us that are active and engaged in the workforce are freed up to do so. And it's time for our policies to catch up to reflect that. So a lot of opportunity, and clearly it's an issue for women, increasingly so, as we all look at the demographic trends on the horizon. So not a surprise in the data and a lot of opportunity.
Yeah, Ramsey, if I can interject, I mean, I think you just hit on some powerful points of things that NCOA is doing in terms of policy and legislation, which is critical. That gets to some of the systemic issues that we have. The one piece that I like to offer, and this goes back to, I often get asked, what can I do? And sometimes as women, we feel like we go into a state of analysis paralysis, like I shouldn't do anything. And when I look at these stats and I look at the previous stats, and I'll know at the end of this, I saw a question come through the chat about where are we getting these survey stats, and we will be able to release those, is that I think is also important is allow this to be kind of the catalyst of you having conversations with your loved ones. I always say the pandemic was the great equalizer. There is not one man, woman, child that didn't understand the impact of caregiving. But I also use this opportunity with my own family to sit down and say, not only to my mother, how do you want to be cared for? Knowing that you're a widow because you're 81, and what do we need to think about? But also with my own children. And they're close to 16 and 20. And you may say, well, that's kind of early, but it's such an important conversation. And I think if I could begin to plant those seeds in their mind, in their head, about how we're having this dialogue as a family, they in turn will look at those impacts of what it has for them. So again, I would just offer to this group is really think about how can you make this a comprehensive conversation with your loved ones? Because so often, to I think Ramsey and I's point, we know it's our duty as women, but we don't often talk about the impacts that it'll have that could really change the trajectory of not just our lives, but our loved ones' lives as well. So just so important to think about that as we're going through this conversation.
I couldn't agree more. And I think those conversations need to happen, and modeling for the next generation of women to have these open conversations about money matters and about retirement planning and our own needs. So important to model that for the next generation and have a very comprehensive conversation together. And I fully agree. There's a lot we can do as individuals. We also need to update our policies and our systems that are so antiquated in many ways, really based on old traditional lifestyles, household composition, and workforce dynamics that have changed considerably as women are in the workforce. Households are two breadwinner households. And so at NCOA, we're really excited about some of the bipartisan policy opportunities that are in play right now. We're advocating for the Secure Act 2.0, which seeks to expand employee access to retirement savings plan, making it easier for employers to extend opportunities for retirement savings to part-time workers in particular. So many of our part-time workers are women, individuals of color, and getting these tax advantage retirement savings vehicles for those workers would really go a long way in terms of getting on track for financial security and financial planning. We also think there's an opportunity with the RISE Act, another bipartisan piece of legislation aimed at helping workers save for retirement. It would create an online database to help workers find their retirement plans from jobs they may have left a long time ago. We're all living these multi-stage, nonlinear lives and changing jobs and careers, but we need a tool to help us ensure we keep track and make the most of those dollars we've saved at different employers over the years and not lose that hard-earned money. So the RISE Act and Secure 2.0 would be fantastic opportunities. Every little bit helps. And we know that individuals want and need to save. They just need the right tools and resources to do so. So very excited about some of those opportunities on the horizon.
Amen, amen, Ramsey, on both of those. I want to talk about some of the things that we're doing at Nationwide as well, and places where we're jointly working together. But I would be remiss if I didn't look at this gender gap and also talk about some additional research Nationwide is doing around the equality gap. So one of the places that we dug a little bit deeper last year, and we're going to continue to do this with other diverse market groups, is we looked at the Black caregiver segment. And we wanted to look at that from an equity lens to really understand what was the difference that were happening in the Black community as it relates to caregiving. And it was actually even more startling and an opportunity that we saw once I get into the solutions in a moment. The first we saw is that on average, Black caregivers were giving caregiving at 34 hours a week. So that was roughly almost 10 hours more than our white counterparts. And that was really startling because when you think about 34 hours a week, I don't know about some of you, that could be a full work week for a lot of us, to some degree. And so the fact that they were giving caregiving at that amount. The other thing that came out of that study is that on average, they were spending out of their own pocket, which goes back to the earlier comment, $615 approximately a month out of their own pocket for caregiving. So again, just that need that, and I look at it, growing up in the Black community, it was your responsibility. When your parents and your loved ones age, aunts, uncles, grandparents, you took care of them. But there was never really a dialogue about how that was going to be funded. And so now the opportune time we saw with that study is ensuring from an equity lens that we're making sure that we're closing some of the wealth gap by having this conversation and bringing forth protection and solutions that would allow individuals not only to feel confident that they can provide that care, but give that much needed caregiver that support. So I wanted to make sure that I really called that out from an equity standpoint, and just so excited, Ramsey, that you brought up the policies that you all are impacting. As you're aware, we're doing a little bit of partnership with National Council on Aging on the Secure Act. And this is a place nationwide has been involved for years in a bipartisan way to really focus on the Secure Act and how we can ensure that we're looking at women having that security around retirement. But Ramsey, you brought up a point that I absolutely love a little bit earlier. You talked about most women can't afford a $2,000 event. And so what we have done at Nationwide is really been advocating with Congress and on the Hill to focus on how can we allow individuals to get access through the Secure Act, that emergency funding without penalizing them with taxes and fees. And that's so important. And we have to do this together, not just in a short-term manner, but really thinking about how we can influence policy long-term. And that to me is like one of the power, I'm getting goosebumps and strengths around the relationship that Nationwide has with the National Council on Aging, because we do need to think about for-profit and nonprofit coming together to truly advocate for these policies in Washington, D.C. to make change, sizable change for women to have what they need. So excited that we can join together on that effort. But also we'll have, I know, a slide, probably it's coming up as well around some tools. One of the other great things that we've done with the National Council on Aging is focus on My Medicare Matters. So they had a tool that we jointly partnered with them to actually deploy out to our financial professionals and consumers, knowing that healthcare cost is the second highest cost in retirement. And really, how are we getting more knowledge around that? So we partner with NCOA to do that, to not only say, how do you understand what you have, but actually drive towards action where individuals can make purchase decisions. You can also find free of charge on the Nationwide Retirement financial page around our healthcare assessment tool. So really going through answering a few questions around healthcare and understanding what you need, and then pairing that back with the Medicare, as well as that long-term care calculator. I strongly advise everyone to do that because we all are in different places, and you can leverage this long-term calculator for yourself. For both Ramsey and I do feel like we're in that panini situation, but as well as for your loved one. So I did want to also call out some of those resources that we have available jointly, but also that we have available at Nationwide free of charge to you.
Fabulous resources, and in particular, maximizing that Medicare enrollment to ensure you get the best bang for your buck and the greatest health security is so essential. So we're pleased to partner together on that free tool to help inform and educate. There are other NCOA tools that are also free and available that may be able to help. And one that's particularly powerful, I believe, is benefitscheckup.org. Benefitscheckup.org connects eligible older adults to 2,500 different benefits programs that can help with daily expenses related to food and medicine and healthcare. Many people don't even know these benefits are available or don't think they're for them, but you've paid into the system. They're there for you. It's time to take a look and benefit from them. And caregivers can take the assessment as well and then get their loved ones enrolled, defraying some of their own out-of-pocket costs, which can be considerable. There can be thousands of dollars worth of public and private benefit programs on the table for an individual to benefit from. It will go a long way in freeing up the budget, supplementing the budget for a greater quality of life. We also provide the Age Well Planner at NCOA, another free tool available, which helps personalize your understanding of what you might need in terms of lifetime income and other supports related to aging well. It provides personalized resources, tools, and expert help for financial and health issues. So take a look at those tools at ncoa.org and be sure to share them with loved ones. Well, as we begin to close out our time together, we've seen a lot of questions in the chat about where is this data coming from? Well, it's hot off the press to be shared with you today. You can find it at ncoa.org/research. You'll find the full survey results, all of our findings, some great deep dives on what women want in retirement. Kristi, thank you for your time today and for your partnership on this incredible body of work together. It's such an important conversation, such an important topic to elevate. I really appreciate your partnership.
Absolutely. Thank you so much, Ramsey.
And thanks to everyone for joining and tuning in today as well. If you'd like to find those full results, be sure to go to ncoa.org/results. Pardon me, ncoa.org/research to find them. We'll be posting a recording of this webinar as well. And while you're on our website, taking a look at the webinar, sharing with others, be sure to sign up for our newsletter so you can learn about more upcoming sessions like this and other events from NCOA. Thanks so very much for your time and interest. Have a terrific rest of your day. Take good care.